Hi, my name is Joan Melton. I'm a nurse practitioner. I work at Harrison County Hospital in Corydon, Indiana. I wanted to share a few tips with you today, particularly people who have diabetes, to help them to get through this coronavirus pandemic and stay healthy. There's a lot of information coming through the news, and I want to try to break it down to the most vital information that's important for you, things that you can do at home. First of all, we have to talk about hand washing. Hand washing is one of the best ways to prevent spread of infection, and making sure that you wash your hands for 20 seconds. You have to wash both sides of your hands, front and back. You have to wash between your fingers, include the thumb, and also make sure to wash the tips of your fingers and under your fingernails using just plain soap and water. Some tips that's been out on the internet is to make sure that you do it for 20 seconds. You can sing happy birthday 2 times and that will equal 20 seconds. You can also make up your own songs, or I've sang You'll Be Coming Around the Mountain. I sing 2 verses of that, and that makes 20 seconds. So washing your hands is a great way to stay healthy, no matter if we're dealing with the pandemic or not. The other tip that you already know probably is to not touch your face, because our mouth and our nose and our eyes are a direct way to spread infections into your body. So avoid rubbing your eyes, and anytime that you cough or sneeze, you want to cough or sneeze into your elbow. After you cough and sneeze, wash your hands. Be sure to dispose of any used tissues. And if you touch your nose or blow your nose, be sure to wash your hands afterwards. Which brings up the question, when do we need to wash our hands? Of course, anytime that you're handling food, you need to wash your hands before that, because we eat this food and we want to make sure that our hands are clean. So before and after meals, you want to definitely make sure you clean your hands or wash your hands for 20 seconds after using the bathroom. Or when you touch any surfaces that might be contaminated, particularly things that get touched often, like the kitchen counter where you prepare the food, or doorknobs, or levels on the toilet, or handles on the faucet, or even the car door, maybe. Anytime that you are touching a surface that might be contaminated. You also want to make sure that you are doing your best so that you don't spread your germs to other people. Don't be shaking hands with people. No hugs. We've got to keep that 6 feet social distancing. For all of the people here that have diabetes, you also know how important it is still to keep close tabs on your blood sugars. You want to check your blood sugars just like you always do. Make sure that you wash your hands before checking your blood sugars, and wash your hands before taking your medications. You should be taking your medicines on time and having your meals on time. These are important things irregardless if we're dealing with a pandemic. I'm sure diabetic patients are used to keeping a routine, and it's important to continue to do that. Make sure that you take your medications with meals. Now, if you're having problems that's unrelated to the COVID-19, maybe you need some questions answered, or even if it is related to the COVID-19, maybe you're feeling sick, be sure to call your doctor if you need medication refills, or if you need refills on your glucometer strips. Be sure to get in touch with your doctor, because they're still available for you. But you have to stay home. So many healthcare providers are implementing what's called telemedicine. Telemedicine is a new type of communicating with your doctor. It's very simple. It can be done on your phone or your computer. We're using the Google Duo app, and all you need to do is get in touch with your healthcare provider and ask them if it's possible for you to have a video visit. They will be happy to set up the instructions for you. It's very easy. Even if you're not good at technology, I've done it with several patients and it's gone very well. So in fact, it's very easy, so don't be afraid of it, okay? And it helps us to stay in touch, so it's a good thing. So finally, I do want to tell you about the social distancing. I mean, we do miss seeing you. We do wish that you have continued health, and the best way we know for that to happen at this time is to stay home until we get past this pandemic. All these actions are extremely important, making sure that you take care of yourself. It's a critical time right now, and some people may have trouble with the social distancing and might develop some depression or some loneliness. It's a time to reach out to people, to reach out to your neighbors, but be safe. Keep the social distance. You can call them on the telephone. Check on your family, make sure they're doing okay. Be a little creative. Maybe you want to exchange some recipes or try some new recipes. I know people that have diabetes always like to find some good healthy recipes to try out. And try to get some activity in your day. Go outside, do some yard work or chores that you've been pushing off doing. You might want to, lift your spirits by reading a good book or taking up a new craft project. Whatever you decide to do, it's important for you to stay active and at the same time stay protective and safe. So Harrison County Hospital staff is here for you. Just call, set up a video visit if you would like. It's okay to call us. We're here to answer your questions so that you can stay home and that you're still able to talk to your healthcare providers and feel like we're there for you. You can see us face to face. So thanks for helping us all out by staying home and by following these easy steps of washing your hands, not touching your face, keeping the social distancing, and keeping a close eye on your own health by checking your blood sugars and eating healthy, staying active. So thanks for helping us by staying home. And we wish you and your families at home continued safety and good health.